President Trump announcing over the weekend the Food and Drug Administration has given emergency authorization to treat COVID-19 patients with convalescent plasma. Fox 24's Jian Kim spoke with area hospitals today. She joins us live in studio with more. Jian?
That's right. Area doctors say convalescent plasma has actually been in use for some time now. It's just the first time the results of its effectiveness have been publicized. Now, I had a chance to hear from our local doctors today on the pros and cons of this treatment. Convalescent plasma refers to the protein portion of the blood that contains the antibodies to a certain disease.
When we look at something like convalescent plasma, the important thing to remember is that it's not going to be the be-all, end-all. It is one of the many things that we can use to support the body in the healing process.
There's still so much unknown about its benefits and side effects, but the Food and Drug Administration has given emergency authorization to treat COVID-19 patients with it.
Selection criteria we've been using so far favors those that are rapidly progressing in the disease and have a good chance for recovery.
Like with any treatment or procedure, it works for some and not for others. There's still not enough data at this time to support widespread effectiveness.
Well, do we know enough about these antibodies? How long do they last after someone recovers? How effective are they against maybe a slight variant of a strain? We don't know the answers to those questions. And that's why we're having mixed results with regard to effectiveness.
Dr. Timothy Benton with Midland Memorial says the effectiveness also depends on variables out of their control.
We'll continue doing what we're doing, maybe ramp up some, but it also depends on availability of plasma too. And as it's become more available, maybe we've seen a little better results.
There's currently FDA guidelines on who can donate plasma to. They must have been diagnosed with COVID-19. Enough time must have passed to deem them recovered. And they must prove enough antibodies are in their system by taking a test.
There can be protein mismatches, ones that we don't test for, that can still cause reactions. So that is the biggest side effect we need to watch for.
Now, the National Institute of Health has a way of listing recommendations. Currently, it says there's insufficient data for the panel to either recommend for or against the use of convalescent plasma. For reference, the drug remdesivir, as well as ventilators, are on that list as recommendations. Reporting live in studio, I'm Jian Kim, Fox 24 News.